Very good afternoon to all of you and a very warm welcome. Exactly a year back, I was with Himanshu Doshi and Dr. Manjari talking about a therapy center that I wish to start. And I'm here today, a year later, going to talk to you about what we are doing at the therapy center. What is it? The Singhania Shaping Therapies is a center for all children who have special abilities and who need some educational support. To talk more about it, I have both Himanshu and Manjari with me so that we can clear doubts of parents and we can also talk to you about the center. We started this around June 1st. It's not even 6 months. We have so many children who have benefited by all the therapies and all the facilities that they have availed of. So this question often comes to us as to who needs help, when should the intervention happen, how early can the intervention happen, who can intervene, and how do we support parents? What are the kind of doubts that a parent may have in his mind or her mind about children with special difficulties or with special abilities? So how do we go about it? So our conversation today is all about Singhania Shaping Therapy Center. All parents can clear their doubts by putting across their questions on the chat box. We are here to solve it for you. We'll try as much as possible to reach out to each of your questions so that you know what the center is all about. So on to you, Dr. Manjari. I'm going to ask you my first question because as a principal, when I wanted to start the center, the first thought that came to me is that how do we help children, especially during this pandemic? How do we help them come across to learn something so that there are no long or major learning gaps? So that was the reason why I hurried to start the center during the pandemic. And for the benefit of all of you parents, I must tell you that the center, we worked very hard to get it inaugurated during the pandemic. We worked hard to set up the entire center during the pandemic so that children with special difficulties stand to benefit. So we were very, very happy that we had so many children every day coming across. Not just children, the center is even for adults, for counseling, for anything. And that is the reason why my question to Manjari would be is that how does it benefit?
Okay. Yes, the pandemic has really been hard on us, and as we all know that children have really suffered. Having said that, not only emotionally, mentally, cognitively, but yes, the developmental milestones in a normal environment, how they would have been otherwise, those basic developmental milestones have not been achieved. So right from motor milestones to speech milestones to social milestones, like even interacting with, because unfortunately we are not only nuclear families, but we've got down to single families where only the mother and the child would probably be at home. Having said that, early intervention, as you have rightly mentioned, is the only answer to get the children make up for this 2 years of pandemic as fast as possible. So one is as early as a 1 or a 1.5-year-old child also could be diagnosed with even ADHD, autism, any kind of developmental delays, any kind of speech delays is what as early as a 1.5-year-old also can be diagnosed. I request parents, I request grandparents, I request any people who are watching this, do not delay in your decisions. At least come and ask for any professional help so that we can guide them at the early stage. And the guidance has to be a holistic guidance. So if a child requires occupational therapy, along with that a child requires speech therapy, along with that if a child requires even remedial or behavioral therapy, everything is there under one roof. So having said this, as simple as walking up steps. So we all use elevators, we all live in high rise, we all live in our individual apartments. So even climbing steps is a huge major milestone. So sometimes we parents think that crawling achieved, sitting achieved, walking achieved, great, my child. But climbing upstairs, it's a very important milestones, and nowadays children have actually missed that or cannot do that. One climbing step involves a lot of processes like balance, understanding, depth perception, taking the body weight, taking one step at a time. So it's a very small step, but involves the holistic body to achieve over there. When it comes to speech, we've seen a lot of children at the age of 5 going through misarticulations. That is on a high rise simply because one, children are looking at videos which are in an animated form, which are not our language like Hindi, Marathi, or English. And that's why these misarticulations, especially with the letters like r, l, v, ksha, where rolling of the tongue is required. So the oromotor movements have got affected. So the earlier that the parents come to us, it is better for us to deal with the child, and in 3 to 6 months we can guide the children better.
Yes, thanks so much, Manjari. So to Himanshu, I'd like to say, when I spoke to you about setting up the therapy center at Singhania School, and not even a second, I remember you thought about it. You said, yes, ma'am, let's do it together. What made you say so?
Basically, the confidence which obviously comes to open up this huge world-class center is only when there is a proper guidance and a backing. And I must say that it's one of the reasons is formally you, that you have been around us and guiding us through as to how the center has to open up. But as always, because it's Singhania and the Raymond Group and everything, we always wanted to make it as a state-of-the-art center. We had an experience of running therapy centers, but when we thought about opening up Singhania Shaping Therapy Center in Singhania School, we were very, very clear that we want to start anything which is state of the art and the world class therapy center, because in India, basically most of the therapy centers are standalone centers. They may have one therapy going at one time, and parents obviously require multidisciplinary approach at one time for a child. So it's like, in a layman's language, a child will not go to one school for studying science and one school for studying maths. They have to have a holistic place where they can learn everything under the sun. That was the vision of opening up a Singhania Shaping Therapy Center in Singhania School, by the means of which now anyone who has been coming to us, not only from the Raymond side or Singhania parents, as you have rightly said, it's open for everyone, not only from Thane, not only from Mumbai, but from online sessions. We have been right now dealing with people from so many countries or parents from so many countries who require our therapies, and by the means of which they are getting at one point of time all the solutions, giving them a peace of mind that their child or any of their loved ones are in safe hands.
That's true. I think I was really excited that day when I was watching the entire thing on the screen and seeing children from across 12 countries availing
Yes.
the benefits. And, a small center which just started 6 months back, I think that's a beauty of it. And for me, it gives me great satisfaction to know that children are benefiting.
Yes.
That is what it is. Do I feel the confidence to be on my own? That's more important. It's not about educational backup or anything of that kind. I think it's more about being confident about oneself. And I think that's the purpose. Himanshu, can you just take us through the center? Like, what are the facilities?
Yes. So basically, when you hear therapy center, people are at times scared of going to a therapy center. Like normally, if you have to go to a psychiatric for a psychiatric treatment, people may think that you have gone mad, or there is something, you are insane kind of a thing. First and foremost, in the very beginning, I will like to say to everyone who have been hearing us that taking a therapy is not a taboo. Believe me, if you take a right intervention at the right time, be it your children, be it your loved ones, or in fact any one of you who have been watching us right now may also require a therapy, you have to come to us as early as possible to get the right diagnosis. Now, we only talk about children. These certain issues which normally children has nowadays has only come into a limelight in the last decade or so. And Dr. Manjari will tell me about it, that when she was studying psychology, all these topics that we are talking about right now were like a small paragraph in the entire psychology thing, because no one is to take it so seriously. all these issues are directly connected to the population. So the more the population in the country, more the chances or more the probability of having children with certain disorders is very high. Most of the parents may think that giving a normal birth to a child is the way how a child is normal, and if a child doesn't have any kind of physical disability, that means a child is normal. But no one knows as to what are the root causes of certain disorders which I will mention, which are autism, which is learning disability, which may have again very scientific ways of looking at dyslexia, dysgraphia, dyscalculia. We will not go much into the technical part of it, but be it autism, be it ADHD, be it learning disability, be it cerebral palsy, all this requires therapy. To a certain disorders like ADHD, people may require certain medication, but medication is always incomplete without a right amount of therapy. So how do you deal with all these kind of disorders and challenges? You require certain therapies which are occupational therapy, speech therapy, remedial education. If someone has an hearing issue, then the hearing, audiometry test to be done. All these things are the kind of facilities that we have. And to add more into it, we have got animal assisted therapy, we have got sand therapy, we have got snoozelen therapy to facilitate a child and help them out to get the right amount of therapy. There have been parents who comes to us saying that we require a physiotherapy. But now in occupational therapy, you have also something which is called as an NDT, which is a very technical term, but when parents will come to us, we'll explain them. That is one part of how the way of the physiotherapy normally happens. But basically for the children who requires NDT, then physiotherapy is not the right answer for them. So as madam was asking us to what are the kind of therapies, there are more than 16 therapies that we have been doing all under one roof. All you need to do is any kind of a doubt you have in mind, all you need to do is come and ask the doubts and clarify as to whether you're on the right track or not.
Oh, that's nice. Anjali, would you like to say something about where do you see difficulties when you're handling such children?
Okay. One is, as we have always said, the early intervention. Second is acceptance of parents. That is the first hurdle that we find to make parents understand that one is the acceptance, second is the guilt. Okay, because nowadays in the pandemic, because both the parents who were working and the child was left on his or her own to watch the TV or the tab or the mobile, exposure to gadgets is what created a lot of this chaos. But having said that, understanding where you will have gone wrong, accepting where you will have gone wrong, and rectifying. If all these things are taken care of, then we are good to go. As far as the hurdles are concerned, one is, as I've said, the acceptance part. Second is when the parents think that is only the therapist's responsibility to for the therapy to happen, but that's not how it happens. Because we are professionals, we teach the approaches and the techniques to the parents or the caregivers or to the guardians. It is also their responsibility to hand in hand work with us, because the child comes to us twice a week or thrice a week. Eventually, otherwise, for 23 hours, the child is at home. So whatever we do with the child has to be multiplied, has to be executed also in the very general setup. That is where another hurdle comes. Also, the most important, if there are grandparents at home or if any elders who say that wait, 5 saal ka bachcha hai, ho jayega, hold on, it will happen, and then our early intervention period is gone. When the child comes to us at 6 years of age, it gets very difficult for us. So something that can get rectified in 3 months or 6 months takes about 3 years. So from 6 months to 3 years is a huge gap. So parents kindly do not wait. Also, this is for the pediatric or the children's. For someone with adults or geriatrics, again, adults with any kind of psychological concerns like depression, anxiety, work-related stress, relationship fears, phobias, anything. So this is not only a pediatric setup, but we also have mental health professionals taking care of adults and adolescent children, especially again with this pandemic. Your career is going, you don't know where your careers are going, your relationships have got affected. For all of these, we do have mental health professionals for there too. Yes.
Yeah, but I'd like to intervene over here just a little bit because my observations of children in classrooms, because
Yes.
I have also been a kindergarten teacher and I've been a primary school teacher and a secondary school teacher, and I've taught the 18-year-olds.
Yes.
And at every point of time, I see sometimes that when children are not in the habit of writing or not really glued to academics.
Absolutely.
Okay, So there's a kind of a laid back attitude towards it.
Yes.
How do I draw a distinction between there is a problem there or a difficulty there and is just laziness?
Yes. Okay. So if this laziness is there, it is generally in everything that the child does. Yes, if the child wants to play, then the energy suddenly comes back. But if we are talking about the writing part, the entire muscle tone of the child or the posture of the child has to give assistance to the child to write. So when I know that the child is stooping, when the child is not giving as much of aid when he has to write, when I know that the child gets tired very easily, there is no eye-hand coordination, there is no perceptual motor skills, there is no visual motor and visual perceptual skills, that is when the child has concerns only with these things. But that is not then generalized in his other areas as such. In such a scenario, we ask the parents to only assess the child. So we have professionals who only do a very peripheral assessment of the child, whether the child has really concerns or that is the nature of the child, or the child really does not want to do anything, which is absolutely fine. And we do encourage that also, that is the general way of the way the child wants to grow. Like, for example, like the movie of Tare Zameen Par. Yes, he was dyslexic, but the child was excellent in art, and that is where he saw his calling. That's also one way where remedial education also comes into the picture, where unfortunately in our Indian education or our system, education is an important part. But we push the child to one extent, but the other doors which are open for the child, we ask the child to excel in those also. So that's how, it's a holistic approach. So once I see, fortunately for us, we have an occupational therapist, a speech therapist, a behavioral therapist, a psychologist on board. And we all look at that child as the center. So when we see that the child cannot write for a certain this thing, maybe the behavioralist says that no, that's his nature. He is inferior. He does not like to read or write. So you're like, fine, then that's not an occupational, he does not need occupational therapy, and we stop at that. Just because the child has come to us, we don't force that the child has to take therapy. That's the main reason of Singhania shaping therapies also, that we guide the parents in the right direction. If the child does not require therapy, we do not give him therapy.
In fact, that was my idea of setting up the center also in the school. Because if there is a child who's unable to sit for a long time doing something, and some children are like that, a little restless, you can move them to the therapy center, let them be doing some activity. That will be a kind of a distraction, and then they come back and they'll be able to concentrate better. And I think that really works well for the children. And sometimes, a little guidance from the counselor also helps. A little talking with, because sometimes a teacher, she's got many kids in a class and may not have given individual attention. And so that's my next question then. What is the kind of a role that a shadow teacher plays, and till what age can a school have a shadow teacher in class?
Okay. A shadow teacher should not primarily make the child dependent. The shadow teacher is just to take care of the child's well-being, but not make him dependent, because we know shadow teachers who pick up their bags, feed them food, write for them. That's not what a shadow teacher's task is. The shadow teacher's task is to actually be the shadow of the child and not do the activities for the child. The shadow teacher can be there till 5th grade, till the child is independent in doing his or her activities of daily living. So till the child can write, eat, be around in a class, knows the transition from one class to the other class, is where a shadow teacher can come into the picture at a very early stage. Eventually, the child needs to do his or her things on his or her own. A shadow teacher, again, should be educated, okay, should go through a training from a proper institute of there are very well-known and reputed institutions which take care of these. These are not educated maids. So we discourage parents who, send maids as shadow teachers to school, because that's not what shadow teachers are. That's the reason why we also do training for shadow teachers over there, where we make them understand their primarily role as to why you're going to the school or wherever you're going to the tuition or wherever with the child. The child has to do his or her own activities by himself or herself, and that's where the role ends. There has to be a fine line drawn between what the child does and what the shadow teacher does. But 5th standard is the maximum that the shadow teacher can assist.
I think otherwise they get very
Very
dependent.
used to it, yes.
Yes,
Very
yes.
dependent, and they see them more as a crutch to lean on.
Exactly. Yes, ma'am. Absolutely.
That's nice.
So I'd like to add into this. Can you explain parents? So as an adult, we know that we are going through a psychological challenge, be it, anxiety or depression or not, having a willingness to work kind of a thing. What are the kind of early signs that when parents notice in their children, they should, be alarmed and they should say that, I need to now go and visit the therapy center. So maybe the 5 points of, how autism can be on a prima facie be, thought about, or maybe how the ADHD, or maybe how the speech delay can be identified.
Yes.
If you can, just put a light on it.
Sure. So when it comes to developmental delays, if your child, so when it comes to communication, let me first hit communication because that is maximum that is affected right now. If your child is 2 years of age, you should understand 50% of what your child is saying. If your child is 3 years of age, you should understand 75% of what your child is saying. If your child is 4 of your years of age, you should understand 90% of what your child is communicating to you. When we talk about speech therapy, there are 3 ways. One is communication, second is vocabulary or language, and the third part is the speech therapy. So when the child is unable to point and say or gesturally tell you at the age of 2 years what he or she wants, that is one alarming situation. If the child is unable to follow commands, so if you tell your child, go and give this to me or take this, and the child is not able to comprehend, that's the second sign. So there are 2 ways of communication. One is receptive and second is expressive. So receptive is when you talk to the child and the child understands. And expressive is whatever the child has understood, the child reciprocates back. When there is a hamper between this, you really need to get your child to the professional. The second is misarticulations, as I had said. Now, misarticulations also, there are many. So there is omission, there is addition, there is distortion, there is sublimation. So when the child misses some words, the child repeats certain words, the child adds on to words or cannot blend certain words, is when the child needs to see a speech and language pathologist. When it comes to developmental milestones, if your child, again, now there is a very fine line between a child being mischievous and a child having ADHD. So a child with ADHD will not sit in one place even if there are toys around him or her. He will be all over the place. He will be wanting things. He will be snatching things. He will be intervening in whenever we are talking. He will ask for attention. He will be completely on the go, right? The child is not looking at you when you're talking, so there is no eye contact whatsoever. Or if there is eye contact, they look at you, but they don't maintain it. So the eye contact is established, but it's not maintained. When you call the child's name, maybe Ayush, he does not respond to his or her name. When the child is excited, the child starts flapping his hands. That's one sign of autism. And the child is very tactile sensitive. So he has issues with brushing, concerns with cutting of hair, cutting of nails. If there is something on his hand, he or she will, immediately wipe it off the face, the hands. They have concerns with textures. So these are again, and these all happen in young children below the age of 3.5 years. If these concerns are still persistent till 5 years, then it is surely a concern. Also, when it comes to speech, again, there are many times when the parents think that the child can hear, but it's not only the hearing that we are looking at, but we are also looking at the frequency of what the child can hear. Because of headphones and because of the loud volume that the child has been hearing, we really need to, at a gap of 1 year, the child needs to get tested for hearing, especially if the child has been tested positive for COVID. So it has been proven and it has been said that if the child is COVID positive, then there are higher chances of a child having a hearing loss. So this is also one of the reasons why we have an audiometry department at Shaping Therapies, where infant screening, audiometry, Vera testing, hearing aids for that matter, cochlear implant, everything, ma'am, as you know, has been taken care of by us.
So that's great. I would like to, add, and this point has always been running in my mind, that therapy centers are always a standalone centers. We obviously, had our centers before at various locations, but when I think Singhania School, under the leadership of Revati ma'am, I think this is one of the first schools which has a full-fledged therapy center. There have been leaders who will say that let's start in a piecemeal. So let's start. I will give you a small place. Let's start with one therapy. Let's look at the response of the parents, and then we will start with another therapy and the third one. But having this vision and having this courage of opening up a full-fledged center or nothing, how did this courage come to you, ma'am? And this is so important because right now the schools are online, but when the schools will start getting offline, I think this is a school which is going to set a benchmark for the education industry, because if your child is not able to sit in the classroom, a teacher will just either, most of the schools nowadays have a good counselor to help them out, but the teachers are not aware as to what a child is going through. You may either ask, through a disciplinary method of, getting a child to stay quiet, or you will not pay attention to that child, but that child requires, a motion break or a sensory break. And as I was saying, this is going to be one of the schools where if a child is ADHD, then during the school working hours, a child may be, put into a therapy center for a certain amount of time, and then the child will be again going back to the classroom. This will help a child to achieve academically so well. At the same time, their physical needs are getting satisfied. So my question to you is, ma'am, is that again a very short one. How did this courage and a vision come to you at this point of time?
I've always felt that children across the globe, wherever they are when they're born, they're all born intelligent, and all of us have the same abilities. Somewhere there are difficulties that come in, but there is no such difficulty that cannot be sorted out. And if we don't put all children on the same platter, we do not give them the confidence, okay, then I think the purpose of education is not served. Education has to be inclusive, and it should be that you're giving opportunities to all children. So when someone is not able to cope, what do? You, as a school, you have to give that support system. To me, a school plays the role of a community center. It is not just for your children, it is also for parents, it's also for people who need help. And if you are in a position to set up a center, do set it up so that children from the nearby localities, irrespective of which school they belong to. I think Singhania School has attained the kind of position that it is already in now, and where we have had lakhs of students passing through the portals of Singhania School, doing very well in life. It is time that we are also giving back to the society in some way or the other. That is one. But more importantly, for me, it means giving all parents an opportunity whereby, in case you're having a difficulty, we are here to sort it out for you. That's about it. The second that I really feel very strongly about is that it is very important to educate parents. Whether be it academically for academic matters or about anything about schooling or about education. It's important that we take all the people along with us. And it is in that dream that I had was the idea that let's do a therapy center. Parents will come in when they need help. Even if there's no help sorted, at least they want to clarify some doubts. That way the society gets educated. When you have a society that is educated, you will have the next generation of learners absolutely equipped with the right kind of skills to be able to face any kind of problems that they come along in life. And ultimately, what are we all here for? We are trying to make children confident, being able to pick up the skills that they need to pick up, and at the end of the day, stand upright and say, this is the path I choose, and here I am walking through the path that I've chosen. I think we have done that. We have done what children need to be doing. We need to create a nation of confident thinkers, creative minds. So let's do it together. So that was my whole idea of getting it. And I won't hesitate to start many more therapy centers in all my Singhania schools, because I think that's one way of getting every child good education.
Correct. In fact, when we join hands, you also had a vision that we should start something on the NIOS level. So what's your take on that as well?
So I really want, because sometimes children are not able to cope with very heavy academics. In such a case, an open schooling system will help. Maybe with another year or so, I should be able to get that started as well, so that children do have opportunities to learn in a flexible manner. So that would help children learn better, stand stronger, and we create a very, very strong, confident society.
I think that's the real sense of inclusion, that, whatever a child needs, a school gives. We had a, system before that whatever a school is giving, a child has to, take it in, but
Correct.
now a time has come what a child needs, the demand of the child has to be fulfilled by the school, assuming that what the kind of challenges which may come in ahead, we have opened up this center in such a way that we will understand as to what kind of challenges the family may face, so that when they send the child to the school, they are only not sending them for the education but also to look after the therapy needs.
In fact, I must tell you this, that 15 years back, I started a small idea, I would say, called the Child Development Learning Center.
Correct.
So that was started with about a few counselors, clinical psychologists, and a special center where special educators would help the children. But it worked at the classroom level. And now, as I see education and I see children across, I see that the problems are getting more complex.
Yes.
Correct.
That's when I felt that just sorting it out in the classroom is not going to help. They need perhaps 24/7, 365, and there should be a center that's open. And that's why I insisted that the center should be open all 7 days
Yes.
in the week, so that parents who are working and who can't come on the working days, you still can avail of this facility on a Sunday. So that's something really good, and
Yes.
we've also kept it for very long hours.
Yes.
Yes.
If I'm right. What are the hours, Himanshu?
Start from 9 o'clock in the morning and we'll go till 7, 7:30, 8 in the evening. So it's like almost 12 hours of having a chance of parents to come at any of the slots which is convenient to them, rather than we telling them as to these are the only slots available, kind of a thing.
That's right. So I think we've answered a lot of your questions,
Yes.
and we try to put that in a conversation. The questions that have come up also, we've tried to put it in a conversation. And I wish you all the very best, and I'm sure that this center will flourish, and I'm sure that children will benefit
Absolutely,
of this.
yes.
And that's what really matters most to me.
Yes.
I want the children to, feel good at the end of the day and should not feel different.
Absolutely.
They should feel inclusive.
Absolutely. And that's the tagline of our center. We're changing the way how therapies are perceived in India. It's not anymore what therapist wants to give it to the child. It is what a family needs and what we at the end of the day give it to the family.
So that's what we are. Singhania, shaping therapies for you. For all parents who are interested, you can drop in at our school center anytime during the working days, on all the 7 days, of course, that we are working.
Correct.
And you can meet up with the specialist. Thank you very much for your patient hearing, and I've enjoyed having both of you here.
Thank you so much, ma'am.
Thank you.
Thank you.
Thank you so much. Thanks.